Good morning, everyone. It's great to have you here with us for the Insight APSAD webinar series. I'd like to start by acknowledging the traditional custodians and owners throughout Australia, their continuing connection to land, water, culture, and community, and their knowledge and teachings passed down from generation to generation. We pay respect to elders past and present. And we wish to extend that respect to First Nations peoples who are here with us online today for the webinar and who may be viewing this webinar at a later date. My name's Michelle Taylor. I'm one of the clinical educators here at Insight, and I will be hosting today's webinar. Just before we start, you've seen on that initial screen that you may get in touch if you have any technical issues. We will also have time at the end to pose some questions to our presenter. So if you have any questions as we go along, please drop those in the chat. I'll be monitoring that and we'll have some time to look at those at the end. This is also going to be recorded and available at a later date. So today it's my real pleasure to welcome Dr. Janni Leung. Janni is an NHMRC Development Fellow at the National Centre for Youth Substance Use Research at the University of Queensland. And the topic that Janni is going to be speaking to us on today is cannabis legalisation and public health. Of course, this is a movable feast, which many of us are following with great interest, including, of course, Janni and her team. And she is going to give us a great cross-section that her team have been pulling together and researching for some time.
Thanks so much. Very happy to be here. And as Michelle mentioned, I'm Dr. Janni Leung from the National Centre for Youth Substance Use Research at the University of Queensland. So we're just in Brisbane at St. Lucia here. And today I'll be talking about cannabis legalisation and public health. We are at UQ and just declaring no conflict of interest. So our center here is about finding solutions for young people, and we do a variety of research on issues around addiction and substance use, and our vision is to protect young people. So we are one of the 4 national centers in the field funded by the Department of Health, and we report our findings directly to them to inform health policies and service provisions. So some examples of the variety of research we do. We do some research on alcohol. So before we have some research showing that a lot of people in the community thinks that supplying kids with alcohol could teach them how to drink, but then longitudinal studies actually found that it increased the risk of problem alcohol use later. So we really want to share that finding to the community. We do some research on opioids, psychedelics. We have wastewater analysis research and a lot of cannabis research. And we also have a program of vaping and e-cigarette research. So for example, we did some studies on how our vapes portray to young people online on TikTok and how are they promoted around the area. We will be launching and working with some young people as well next year on a project that we got a small grant for. So back to today's talk. Today I want to share the results we have on cannabis legalization and public health. So this is a series of studies conducted in collaboration with Professor Wayne Hall, who is a famous professor for cannabis research and is the World Health Organization advisor as well. So we did a series of studies looking at the public health impacts of cannabis legalization. So how are we went about it mostly is we did a review of reviews. But first we search for existing systematic reviews. If there is already a systematic review, we'll look into that and what they included, what those studies were talking about. And then if you can see the flow chart here, we will draw evidence from those reviews if they are high quality reviews. And then we do another search for original studies of newer studies that came out after those reviews. And then we analyze the evidence. If there's no existing systematic reviews on the topic, then we just went on to search for original studies to inform our topic. So essentially we did 7 mini reviews, or not mini, but yeah, we did kind of separate searches and reviews on each of those potential topics that are related to what public health impacts have there been since cannabis legalization. So yeah, these are the different topics that we looked at and did separate searches for. All right, so first we looked at what are the perceived harms. So what do people in the general public think about the perceived harms and risks of cannabis? So I've got some references here for the review papers published, but in a super brief, succinct summary, it decreased. So for example, findings from the National Survey on Drug Use and Health. So these are from the studies from the United States, and yearly survey of population household surveys. So we can see that support for legalization over time increased. This graph here shows the time on the bottom, and then we can see if we look at the orange line, this one is the proportion of people in the survey who indicated and reported that they support legalization. We can see that this orange line is increasing over time. When we look at the blue line, that's perceived risk, that using cannabis regularly could be risky. And this blue line here decreased over time. Yeah, so this work was led by Dr. Vivian Chiu. And yeah, last time she was presenting online because it was it was an online presentation. So we all watched her presentation together in a room there. So yeah, next topic we looked at is what about after cannabis legalization in the USA? What happened to prices and potencies of products available in the market? So brief summary is that the price decreased and then the potency of the products available increased. And we know from previous research of the impacts of cannabis use on people's health is that higher potency is associated with higher dose consumed, and that could be associated with higher effects. So this is just a graph of over time again, and the price. So this graph shows very clearly that price per pound of marijuana has decreased over time. And then this graph here shows the THC level in the products, which is the psychoactive part that gives people the high for when people are using the cannabis compared to CBD. So CBD part in the cannabis, when we're looking at it over time, is decreased, and then THC has increased. So we did another systematic review on do cannabis users reduce their THC dosage when using more potent cannabis products? Because one concern is that if a lot of the products being out there in the market are actually getting higher and higher potency, then that could potentially have negative impacts on people. But then there are also pushback, especially from the industry, that, it doesn't matter because because it's argued that when people are using more potent product, they can actually just use less, and they do use less so that then they don't get the harms. But so we did a systematic review to see if it's the case. But we find that it's not. We find there were some self-report surveys that just simply ask people, if you were to use a more potent product, would you use less? And then some people take yes, some people take no. More of the people were taking yes. So that was used as strong evidence that people do use less when they're using more potent cannabis. There were also experimental studies that got a few people into a lab to test, and then they present them with different potency of products, and then just let them use however much they want. And again, it's not everyone use less. Some people use less, some people use the same, some people use more. On average, more people use less, but the proportion of using less wasn't in proportion to how much more potent the stuff are. So yeah, this was a review paper that we published, and then our team did another study. This one is led by PhD student Daniel Dawson, and then so in this study, it was doing a study in Australia to test if they were given average versus high potency cannabis, hypothetically. So we use oregano because we're not allowed to just present people with cannabis. So if people were given that and then just told to, oh, can you roll a joint as if you would normally, and then weighing actually how much they are putting in the joint. So yeah, we got participants in, we did that, and then we find that on average, participants use 15% less when they were given the high potency cannabis. But then people do use less, but then we can assume that higher potency products are likely on average 200 times, 200% higher, or the range could be 25% to 400% more potent. So if they're only using 15% less, then they're not using us the same exact dose. So this is a photo of PhD candidate Danny, who led and ran this study. And then this is a picture of me when I heard that she published her paper. So next we looked at prevalence. So what happened in the United States about prevalence of use when cannabis was legalized? Because one concern is, if cannabis was legalized, then the prevalence is going to blow up. Everyone's going to start using cannabis. So we looked at the existing studies. Most were analyzing household surveys. And then the data show that there are no data showing that all the young people are going to start using. So we didn't find that. And other people study didn't find it as well. And then it was a pretty consistent finding that among people who were already using cannabis before it was legalized, then the people were using more in terms of quantity and frequency. So this could make sense because we saw previously in the other reviews we did that after cannabis legalization, the prices were going down. And so people can buy more products with less money. So it does make sense that people could be using more. There were mixed results. So there are different surveys, not just one household survey in the United States. There are multiple surveys and multiple studies, and there were mixed results for overall prevalence, whether it increased or it didn't really change much, or whether it decreased. So we also looked at what about in Australia? What does it mean if we were to predict? So Australia has household surveys as well. So we looked at the National Drug Strategy Household Survey. And then in it, it's got a question to ask about intentions to use cannabis if it were legal. So we looked at that question, and we focus on young people first because yeah, everyone is more concerned about youth taking up cannabis, especially it might affect the developing brain. So we looked at the proportion of adolescents or young people under 18 who were indicating that they would use the cannabis or try it if it were legal. And we find that, yeah, majority said not use it. So 70% of there. So this is a pie chart. Yeah, 13% said don't know. 13% said they would try it. And then 4% said that they would use it. So this includes people who had already used it before and also people who hadn't. So we looked at among people who said they would use it, then most of them, about 80%, have used it before and 21% hasn't. So we can estimate approximately, based on their self-reported intentions, what is the approximate size of people who were saying that they were intending to use cannabis if it were legal. So yeah, so that's the data there. We also have questions about what about differences by age? So we did a study to look at trends in cannabis use by age, and we find diverging trends in cannabis use among younger and older groups. So we find that we use that same data set, the Australian National Survey data, and we analyzed it between 2001 and 2019. That's the latest survey data available to us for analysis. We looked at prevalence of cannabis use in those surveys by different age groups. We find that cannabis use decreased among the youngest age groups, and there were some increases among the older age groups. So I think what this means is we don't think cannabis is only a thing for young people. We have to start watching out for older people who might be using or starting to use cannabis as well over time. Okay, so what is next is, yeah, in those studies, we analyzed up to 2019, which now is a little bit dated, but it's the latest available data. So when this 2022 data is released, then our center here is planning to do a series of studies to further investigate and monitor the issue about cannabis use and associated risk factors and outcomes in this data set. All right, so next review topic we were looking at is what about the impacts of cannabis legalization on motor vehicle accidents? And many people are interested in this. So cannabis and motor vehicle accidents. So research are showing that using cannabis 1 to 3 hours before driving, then systematic review and meta-analysis show that the increase of motor vehicle accidents and injuries are about 1.4 to 2.7. So when we are looking at road crash data in the United States, there are mixed findings. So there are some showing increase in THC detection in fatalities, and that's based on people crashing their car, dying, and then getting their bloods analyzed. And then there's also some data showing that there are increase in cannabis-related accidents yeah, when we're looking at the road crash data and the deaths from road crash data, there are some showing increase. There's also mixed findings, some showing no difference, some showing actually decrease. But we also have to be mindful, we don't know if it's actually increasing, or also it could be that after cannabis legalization, we could be more interested in looking for it and testing it as part of the blood test. So if we are testing for it, then we're more likely to find it as well. So probably we would want to continue this research and further monitor. Okay. So next public health topic we looked at was what about the impacts of cannabis legalization, or what happens to emergencies, hospitals, and other health service presentations? Did they increase after legalizing cannabis in the USA. So yeah, in summary, there were some evidence of increasing presentations, including cannabis-related emergency presentations. So people could be going to the emergency department. There is presentations of hyperemesis, so people feeling sick and throwing up and then going into a hospital, and that later is find out to be related to high level of cannabis consumption. And there's also poison center calls and presentations of children for accidental consumption. So the accidental consumption makes sense because after legalization, there's a variety of different products available, especially in the USA, that looks really yummy or looks just like candy or lollies or chocolate or cookies. So yeah, even if the children are not on purposely consuming them, I think if these stuff are lying around in the house, then yeah, you can't hide sweets from children. I don't think they would find it no matter what. So yeah, there were evidence of increased children presenting in it. Yeah, even just last week, there were a lot of children. Yeah, some people might have saw it on the news in Jamaica that some street vendor was selling some cannabis edibles, and then a bunch of children were buying them and eating them, and then a lot of them ended up at the emergency for some showing hallucination or vomiting or psychosis. So we also have to think about the trends of cannabis vaping. So after legalization, there are more variety of products, edibles, all the colorful packaging and stuff in the USA. There's also an increasing trend of not just smoking cannabis using through a joint, but vaping it. So this is a very topical issue. And then, yeah, this is a systematic review published in JAMA Pediatrics led by Carmen Lim. And then, yeah, Carmen find that when she systematically collected all the evidence about prevalence of cannabis vaping in the USA, then yeah, prevalence is increasing, has been increasing over time. And this is a photo of Carmen, looking very professional there. So yeah, next topic we were reviewing is how about mental health, because there are a lot of research showing that cannabis use is associated with mental health. But what about the impacts of legalization? So is cannabis legalization going to affect the mental health levels of the whole population? So the most obvious mental health problem would be cannabis use disorder. So many people might, if we are thinking previously, we saw that the perceived harm in the general public has been decreasing after cannabis legalization. People might forget or don't think about that, oh, actually cannabis use can be associated with the addiction. It can lead to cannabis use disorders. So we did a systematic review to collect the data, and we find that among people who use cannabis, we find that 24% have cannabis use disorder, including 13% who were dependent. So yeah, previous studies have shown that cannabis use, especially high levels, is associated with psychosis. There are evidence related to, but also mixed evidence, but meta-analysis results showed that cannabis is associated with depression, suicide, and anxiety. But there are no evidence to date that the population mental health levels of these mental disorders are changed given cannabis legalization. So, but because of the changes in products and changes in how people are using, and sometimes it also takes some time to develop these, so we think that we should still continue to monitor this in the population. So other substance use is an interesting topic because many people are interested if we legalize cannabis, then does it affect other substance use? And is that actually a benefit if cannabis are considered a less harmful or less hard drug than other drugs? So cannabis has been proposed as a substitute for tobacco, alcohol, or opioids. So people are asking if cannabis are legalized and if people do switch to using cannabis instead of smoking or alcohol or opioid use, how would that work? And do people actually do that? Would that actually make a benefit in public health? Because at the moment, tobacco, alcohol, and opioids are causing the largest amount of burden in the population, including hospital diseases and emergency presentations. So yeah, there were mixed results actually when we're looking at the data from the United States, but there is no consistent evidence that cannabis legalization has been associated with decreasing of these. And there are some evidence that people might be co-using this or using this together, making it maybe harder to quit, but we need to continue to monitor this. So yeah, we went to the International Tobacco Control Policy headquarters, and that's in Canada, in Waterloo, to work with this, to collaborate with the team to look more into the issues around cannabis and tobacco use. So this is a world-leading research team on tobacco use, and yeah, so we collaborated on a few studies, and we have a few studies that are in progress now. So yeah, these are just example studies that we collaborated on. And we're working with the International Tobacco Control team in Waterloo. We find that we looked at Australian data, and we find that a minority were co-using tobacco with cannabis. But we also, an interesting finding was that we also found that the group that was co-using, they were more likely to report mental health issues, and they were also more likely to report polysubstance or like using multiple drugs and also alcohol. So one of our findings, we analyzed that Australian data between 2001 and 2019, and we find that just smoking tobacco but not using cannabis, that's consistently decreasing across age periods and cohorts. So prevalence of tobacco use in Australia has been steadily declining. Cannabis use with or without tobacco, there is a recent increasing period trend. But again, as I was saying, when the new data come out for the 2022, we will look into that more to see if the trend is continuing. So the changes could be reflecting the strong tobacco control policy and also potentially the changing attitudes towards cannabis use in Australia. Here are some of the students who were working on these papers with us together, and this is a picture of them winning Excellence in Research awards. So we were very proud of that and very happy about that. So yeah, in summary, then observations today about the impacts of cannabis legalization in the USA, we find that in the USA, attitudes and perceptions, there were lower perceived harms in the population. We find the price reduced, the potency of the products increased in the market. For prevalence, the most consistent evidence was that there were people who were already using more, they were using more after legalization. For whether cannabis legalization is going to lead to more accidents, there were mixed results. For health service and emergency hospital presentations, there were more presentations for certain cannabis-related presentations. For mental health in the population, we know that high cannabis use is associated with some mental health symptoms, but we didn't find consistent evidence about after legalization, were there changes in mental health levels in the population? And then for other substance use, we didn't find consistent evidence about decreasing other drug use and alcohol and tobacco use. So we are looking into what other emerging issues are there. And that is, we are thinking use for medicinal reasons is one emerging issue that we are investigating. And this is, we do start a collaboration with Professor Dave Hammond from University of Waterloo, and who is the lead of the International Cannabis Policy Study. So looking at just in Canada and USA, here in this data, we looked at for people who are self-reporting that they're using cannabis for medicinal reasons, our first step is just to look at what are they using it for. So we find common reasons are, for example, pain, migraines, appetite, nausea, vomiting, sleep, anxiety, depression. We also find some percentage of people reporting it for conditions that didn't have evidence for and could potentially even make it worse. For example, there were a substantial minority of people reporting that they were using cannabis to help with their psychosis. And we are going to collaborate more with Professor Hammond, and we have PhD student Danielle Dawson, who is doing her whole PhD on medicinal cannabis use now. And in collaboration, we are also going to analyze the International Cannabis Policy Control Study Australian data as well, to look at extend that to Australia research, and also look at risk factors and outcomes associated with medicinal cannabis use. So we have some research this is research we did led by Dr. Vivian Chiu, looking at support for medicinal and recreational cannabis legalization in Australia. So this study is using the Australian National Survey data, and we find that public support for cannabis legalization has been increasing over time, like 21% back in 2007, and at 2019, that's 41%. And we find that the support for cannabis legalization was associated with people who were living with physical and psychological problems or chronic conditions. And then, so previously, a lot of the results I was talking about before is specifically for the USA. So that series of systematic review we did was based on mostly USA data, because that's the place that had the different states legalizing and more data and more research being published in the area that we can analyze. So we more recently, we also looked at what about in Canada, what in there. And this was published in Addiction, and it was, we recorded as a podcast as well, if anyone's interested. But some similarities, some differences compared to USA. But in the Canadian studies, in summary, what we find was that cannabis-related arrests were declined, like they were less, which makes sense because when cannabis is legalized, then people don't need to get arrested. In Australia, there was a prediction report study trying to analyze what would happen about the cost and economic impacts if cannabis was legalized. And one of the main findings was that a lot of money would be spared because there won't be the need, there will be much less need about spending money on law enforcement and arresting people, putting people in prison, going to court and stuff. So that could be one of the benefits of cannabis legalization. So back to this Canadian study, what we find was that cannabis-related arrests declined. So cannabis prices and markets. So prices declined, and markets and variety expanded. Patterns of cannabis use. In Canada, the household survey data showed some increase in use, and more increase in young people as well. And then driving after cannabis use, there were mixed evidence. And for hospital presentations, there were again increased presentations related to cannabis, including accidental ingestion by children as well. So in the paper version, it's a paper version, but there's a 100-page longer version report that for this that is available on UQE Space if anyone's interested in that. Yeah, so that's the end of my talk, and thanks very much for your attention.
Thank you so much, Janni. Thank you to your team for all that work and for relaying that data to us today. And we will look forward to some of those future outcomes around medicinal cannabis here in Australia that you mentioned will be forthcoming. We've had quite a number of questions, so if you're happy to field some of those, I can present some of those to you now from the people who've been listening online. So a more general one to start with. How much do you think the US media has influenced the perception of the general public on the perceived harms of cannabis? And perhaps you can also reflect on that with Canada as well. I'm not sure, but that's one of the questions.
Yeah, that's a really good question. And exactly, I don't know the answer to that. Our team we have some researchers here looking at the impacts of media, and it does impact, but our research is more on other drugs. So, for example, we have some research on the association between how media are reporting methamphetamine in Australia and how that affects people's answers in the survey. And that showed some very interesting results. So I definitely think the media has a really huge impact on people's perceptions. And that's a very important area to look at.
Indeed. What about another question here? We know there's a large number of adolescents who vape products. And do you think with the prevalence of vaping for young people that there will be an increase in the number of people who will vape cannabis as a preferred route of administration?
Yeah, there could be. We don't know if, so far based on the research, we don't know if the young people who are vaping the flavoring vapes are the people who are vaping cannabis as well. We have some survey data that we collected around the local area, and then we asked people what are they vaping, and most of them said flavor only, and a minority percent of them said they have vaped cannabis. So I think the policy would influence it a lot. And I think the previous media question is really related to the vaping issue as well, because in Australia currently, the media, we are always seeing reports of teenagers vaping as a public health epidemic, and we agree that it's a public health problem. We don't want young people to start vaping, but we also have to be very careful that it's not overblown, because even when we ran surveys for young people, including people in high school, we asked them, how many proportion of your friends do you think are vaping? And then we also asked them themselves, are they vaping themselves? Yeah, people always overestimated how much of other people are vaping. So it's actually a minority of young people who have vaped in the past year, and even very smaller proportion who has who are vaping regularly. Like some people might have tried some like last year or 2 years ago, but they're no longer doing it anymore. But yeah, we shouldn't forget the people who are vaping and finding it hard to quit, but we also have to be very careful for not overinflating the problem, because if a lot of the young people are thinking that everyone's vaping, then it might increase the risk of them vaping themselves as well.
Thank you. Yes, the importance of understanding the perceptions out there. Lots more questions, so I'll start to get through a few more of those if that's okay. A few questions that are similar are wondering about the range of US states, you know, and were the results similar, or were there some differences that might be explained by differences in state regulations, or proximity, being in more liberal US states. So yeah, just people wondering about any information you have around that, around clusters and use in the states.
Yeah, some of the research that we reviewed, they were doing state by state comparisons, or they might group the states that have legalized and then compared it with results from the states that have not yet legalized. Some of the studies were looking at how many years have there been since legalization. So yeah, those are most of what the existing studies were doing, comparing states. Some were comparing before and after. Yeah, it's a bit hard to say exact cause and effect, because there could be potentially other stuff happening in the environment or in the states that could affect people's cannabis presentations.
Yes, and I guess another question that sort of is referring to one of your slides, in fact, slide 15, looking at use over time. So I'll just read the questions for you. Attitudes to cannabis were becoming more positive many years before the first legalization of recreational cannabis in Colorado in 2014, may be affected by medical cannabis changes or other changes. What this person's asking then is the issue is whether the slope of that line changed after legalization. They were wondering, is there any evidence around this?
Yeah, that's a very good point, and that's exactly related to the previous question as well, of is it since legalization that's going to change, or for example, is it people's attitudes were already changing, or some stuff that were already happening before the actual policy change, and then the trend just continued, or the trend changes. So there were some results to compare different states, and then yeah, indicating that it's been affected, but we can't say for sure, because yeah, the trend could have been already happening. There could be other stuff related to the attitudes or like social differences within the states as well that could explain it. So that's a very good point.
Another question, with respect to the potency, you mentioned that people tended to use less when the cannabis was more potent, but the reduction wasn't directly related to potency. Was there any indication on what determined how much people reduced their use with more potent cannabis in that particular study?
Yeah, we are not sure, because in the study that Danielle led, then it was a pretty simple study that we got participants in. We gave them oregano or cannabis, and then we just asked them to roll it, and then later, but they don't smoke it in front of us, and they don't bring their own products or anything. So it was like a hypothetical experiment, and then where we simply asked them, okay, now this is high potency. Can you roll a joint that you would normally use, and then weight that? Yeah. So we don't know if what would make it make people change their stuff. In some of the previous, like very old experimental studies, mostly based in the United States with a few people, maybe like 10 people would come into a lab. There were some reports of, or some people might be getting sick or feeling like they had enough, and then they might stop using it.
Great. Well, I've just about gone through all of our questions online. I guess this is just something that comes to me because there is so much to integrate there and to take in, and it's wonderful to have so much data. I just wondered if, given all of that, if you think there's any, really good takeaways for us as workers, whatever our roles are, those who are viewing this, but there will be a lot of people working with people with substance use issues, using cannabis. And yeah, if there's any, important implications you think, but feel free not to answer that if that's there's a lot of data there. There's a lot of things that might come to mind. Just wondered if there are any thoughts from yourself and the team around important takeaways at this point in time, and thinking, into the future, living and working in Australia.
Yeah, we think that there's a global trend of legalization. So we don't know if cannabis is going to be legalized in the whole Australia or not. But we might want to get prepared in case it will be, in case it's not, and then what we could do to help reduce or prevent the harms. So policies, when we are legalizing, we need to be very careful, given these results, of how, like, if we do decide to legalize it, then we need to legalize it in a way that reduces harm and protects young people in the population. For example, we saw in the United States, after legalization, then the market just boomed with different high potency products. And then people are allowed to show ads around it. So we need to think in advance what might happen based on lessons we learned from the United States and Canada, what might happen to different hospital presentations, what might happen, or what strategies can we put in place in advance to prevent, for example, children accidental consumption, if we saw that that's an issue overseas. And things like that. And just a shout out. So for the APSET conference this year in Adelaide, so that's the end of the year in Adelaide, we are having the APSET conference. So one of the keynote will be Professor Bo Kimmer, who is coming from the United States. He's a famous professor doing a lot of work on the impacts of cannabis legalization in North America. So it'll be very interesting to hear from him the latest result on all of this. And another shout out is other team members of our center, Carmen Lim and Brianna Rutherford. They will be doing next week's Insight webinar, and that will be how substance use is portrayed on social media and how they might affect young people. So hopefully everyone can interested, they can make it or tell their friends about it.
Oh, thank you, Janni. You've just done the next piece of my job, so that's fantastic.
Oh, sorry.
that's wonderful. So yes, next week we have this to look forward to. Thank you for mentioning that. Some more of your cohort there doing fabulous work. Look, just before we do sign off, there was something else asked. Do you think, and this is sort of perhaps, I guess, a bit crystal ballish, but with your insights, do you think that the prevalence seen in youth with that intention to try would be the same in the adult population? And do you think that there would be an even higher increase in use in the 55 to 74, that older age bracket, legalization was to occur in Australia?
If we're basing it off overseas data, then that might happen for the older age group. And yeah, and that could be, we saw that the prevalence of people who are interested in cannabis legalization, they are people with chronic health problems as well, like for example, pain or different type of physical diseases and also psychological problems. So if we're basing it on overseas, that could be a thing. So yeah, that could be another point that we in the workforce might be thinking to watch out for, to make programs and services that are suitable for people of different age groups as well.
Mm. Well, thank you very much, Janni, for that comprehensive tour. It's been, yeah, wonderful to have those insights, and we look forward to hearing more in the future. And for those people lucky enough to go to APSAD, they might be learning some more in this space. Of course, as Janni mentioned, next week, this is the webinar topic you can see on your screen, presented by Carmen Lin and Brianna Rutherford, looking at the online landscape of substance use, social substances. So we look forward to that. And one other special thing to mention, it's Queensland Mental Health Week all this week. As part of that, we will be hosting a webinar tomorrow, Thursday, the 12th of October. That's at 1:30 Australian Eastern Standard Time, so Queensland time. And it's Project AIR Strategy. So that is being presented by the Mental Health, Alcohol and Drug branch, looking at personality disorders and implementation of this strategy in Queensland. That's tomorrow, so you might like to join us for that webinar. So thank you everyone for your questions. Thank you again, Janni Leung and your team, and we'll hopefully see many of you back here same time next week for the next webinar in the series.